All right, for your patient that's had a total knee replacement, in most instances, it's easier to get out on the stronger side. So we're gonna pretend that this is your leg that had the knee replacement, okay? So with your knee replacement, there's no specific precautions. Patients are typically weight bearing as tolerated. So what I'm gonna have you do is we're gonna go ahead and sit up on this side of the bed mat, okay? So I'm gonna help support this leg and guide it over the edge, all right? So what I want you to do, we could either do a rolling technique, or we can kind of do the same thing we just did. All right, so what I'm gonna have you do is go ahead and prop yourself up. We're gonna sit up, good. And you can start to bring your legs over towards the side, good. All right, and for someone with a total knee replacement, you wanna be mindful that bending the knee might be uncomfortable. So if I feel like his balance is okay and I can let go here, what I'm typically gonna do is I'm gonna kneel down and say, all right, what we're gonna do is just kind of slowly start to let this knee bend a little bit. You doing okay?
Yes.
Because blood's going to kind of rush down that leg. It could be uncomfortable for them. Great. And then we'd let him adjust kind of there before we moved on. Getting back into bed, we would do sort of the reverse. So I'm going to support this leg. All right. I want you to go ahead and start to lay back.